In early 2012, an important article was published in the Journal of the American Medical Association, which discussed the whole issue of reoperation surgery after patients have undergone lumpectomies. And it really comes to the heart of a question that we've been struggling with for 30 years. And breast surgeons like myself and radiation oncologists have been struggling with the issue of how much normal tissue do we need to have around a breast cancer after we perform a lumpectomy. If I can use this Kleenex box as an example, if the box here represents the tumor, when we talk about the margins, margins are the rim of normal tissue that we need 360 degrees around the tumor itself, the cancer itself. And let me explain a couple things. When the lumpectomy specimen is processed by the breast pathologist, they do what's called inking the margins. They use different color inks on the different surfaces. So like this Kleenex box, one surface here may be called the superficial margin. One color of ink goes here. Another margin here may be called the caudal margin, toward the tail, if you will. Another margin here is called the medial margin, sort of in the middle. This margin, the lateral margin. The one toward me here, the cephalad margin, toward the head. And the bottom margin here, the deep margin. So different colors of ink are put on by the pathologist. The tissue is then fixed in formalin, and then the tissue is sliced up and slides are made. So we have all sorts of definitions of what are adequate margins. The National Surgical Adjuvant Breast Project has said no cancer at the ink, meaning literally almost right up to the surface here of where the ink is being applied. That definition has been around for years, has served that particular group well. Others have argued, particularly in Europe, that we need much bigger margins, out to 1 centimeter margins. There are those of my colleagues who argue that we need such large margins, particularly in situ breast cancer. And if we can obtain such large margins, frankly, maybe we don't even need radiation therapy. So this argument, this debate has gone on and on and on. And this article in the Journal of the American Medical Association really brings out in the open the lack of consensus, if you will, among all of us. That's one issue. The other issue brought out in this article is the issue of going back to the operating room to reoperate. Personally, I look at the entire situation in the patient. I always go back and operate, virtually always go back and operate if a margin is positive. Occasionally, if the margin is positive down next and into the muscle, we may use radiation therapy instead to take care of that. But when it comes to these other margins after lumpectomy, almost all of us will go back and try and remove a little bit more. The dilemma for me as a breast surgeon is not wanting to remove too much breast tissue, because then the cosmetic outcome dwindles. It becomes less optimal, and yet not removing enough. We know that having positive margins means the chance of the cancer reoccurring in the breast really goes up. The other thing I got out of this article in JAMA was the fact that patients should really be, as I've said multiple times here, should really be involved with a multidisciplinary team of breast cancer specialists. Hopefully each individual team, as is the case at my institution, have worked through these issues of what are adequate margins, have come to their own internal consensus of what is adequate, and then apply that hopefully uniformly to their patients. So you need to be cognizant about margins. Margins are very important. They need to be negative. Please be working with a multidisciplinary team. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor. I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.